When you first launch VxTracer, you see a screen with a register button. Press that button. Next, you see a series of screens with information about the app, its features, and terms of use. After reviewing these carefully, click Agree. The app sends your registration request and consent forms to the server, which generates a new, unique random ID for you. The data VxTracer collects is always indexed by this ID, and the app does not know your name or phone number. To see the ID your phone was assigned, click on Menu and then Settings. Your ID, or coupon number, is now visible in the center of the screen. The app periodically records your GPS location and proximity to other app users, as determined by Bluetooth scanning. It sends this data along with self-reported symptoms and survey answers to the server. The server maintains a secure archive of the GPS and Bluetooth data collected from all users of VxTracer. It makes self-report data available to healthcare workers via a secure website. To make a self-report within the app, begin by pressing the button labeled Report Events. You will now see a collection of buttons corresponding to the different types of reports you can make. This list may change over time depending on the circumstances. When you press any of these buttons, one or more multiple choice or fill-in-the-blank questions will be posed for you to submit your answers. These self-reports are made available to healthcare workers via a website, so that they can provide VxTracer users with guidance and support through the app. A healthcare worker can visit the system website to log into their secure account. From here, they can dynamically customize the types of buttons and questions that will appear within the VxTracer app. In addition, they can trigger a range of analyses. For example, listing the IDs of individuals who reported symptoms recently. Here we see 5 individuals reported symptoms in the last 24 hours. With this data in hand, healthcare workers can initiate contact with these users via the messaging section of the website. All that is needed is to type in the message, select the IDs of the intended recipients, and press Send. Messages are received via in-app notifications, making it unnecessary for VxTracer to know your phone number. As a result of communications with healthcare workers, some individuals may be referred for further medical testing. Individuals who test positive will be asked to provide their VxTracer ID, which is stored within the app. Testing center personnel will then query the VxTracer system to determine the IDs of all users who may have been exposed to the positive individual over the past 14 days. This determination is carried out by geometrically intersecting the infected individual's historical location data with the location data of other VxTracer app users. Here we see the IDs of 11 potentially exposed users along with the date, time, and location of their most recent contact with the positive individual. These potentially exposed users will then be contacted to inform them about possible quarantine and testing recommendations. Such communication is again achieved via the messaging section of the system website. We type in our message, then select the computed IDs of potentially exposed users, and then press Send. VxTracer users thus have the assurance of receiving timely notifications of exposure events as soon as they are discovered. At the same time, location data collected by the system to achieve this is anonymous and not tied to any user's true identity. Via the website, it is also possible to modify the buttons and questions that appear within the VxTracer app. This ability to update the app dynamically enables a truly responsive and flexible system.